Every dry season, a deadly pattern returns across northern Nigeria: meningitis. In 2025 alone, at least 150 people died, with nearly 2,000 suspected cases reported across more than 20 communities. As hot, dusty winds intensify, so does the risk of transmission. For survivors, the impact goes far beyond the statistics.
I spent about 1 month in the hospital receiving treatment. At a point, I wasn't talking. It affected my speech. I found it difficult to speak out. I could not talk. And when people talk, I would not hear. It affects my ears. It was a horrific experience.
Meningitis causes the inflammation of the brain and spinal cord. Its bacterial form is especially dangerous, killing roughly 1 in 6 people infected and leaving many survivors with lasting complications. Nigeria sits inside Africa's so-called meningitis belt, according to the World Health Organization, a high-risk zone spanning 26 countries known for recurring outbreaks.
Outbreaks of meningitis peak between December and April when dry, dusty conditions increase transmission. In densely populated communities like this one in Abuja, overcrowding, poor ventilation raise the risk, and limited vaccine coverage means the disease keeps returning.
To curb the spread, Nigeria rolled out a new 5-in-1 meningitis vaccine in 2024 with support from partners like Gavi. Around 1 million doses have been deployed so far, targeting the most common strains driving outbreaks in high-risk states, especially among children. Early data shows fewer severe cases in areas with higher coverage, but health experts say the supply is nowhere near enough.
Now, looking at the population of over 200 million people, and we are assuming that in those 11 states, if we take the priority population of 0 to 15 years, we are talking about 7 to 10 million people. We've only gotten 1 million vaccines. So we need about 10 million doses to at least cover the priority populations in those high-risk regions. And then we then start talking about the other people who also need to be protected.
And vaccines alone won't stop meningitis for good.
We need better surveillance systems. We need early treatment and rapid laboratory confirmation and testing. We also need good risk communication and community engagement.
Authorities say efforts are underway to expand vaccination, improve surveillance, and strengthen the emergency response system in high-risk states. But for Nigerians like Pastor Ogiri Adoku, the threat remains painfully real. Until gaps in access, awareness, and prevention are closed, meningitis is likely to keep returning year after year with every dry season.